Hello there, kia ora. On Saturday, I was woken up with a worried call from my sister. Our mum was being taken to hospital in an ambulance with a suspected heart attack. Thankfully, it turned out to be a lung infection. She was seen, tested, and discharged with orders for bed rest and antibiotics within 5 hours. She was discharged because there were no beds available for anything short of high level emergencies. Because, like most of our healthcare system, they're running over capacity and under resourced. And that's because of decisions this government has made. And their announcement this week that Te Whatu Ora is overspending because Labour bad simply don't ring true. You see, our healthcare system is the single largest organisation the government has, and clearly one of the most critical. And the actions of this government specifically is increasing the pressure put on an already under stress part of our system. When they first elected, they decided to reverse the amalgamation that was in place and get rid of the Māori Health Authority. These two changes were in the process of happening when they stopped them, requiring more administration work while they demanded less administration people to fund their tax cuts. Now, all the research shows health outcomes in this country for Māori are worse than for non-Māori, and that setting up the Māori Health Authority was actually the best way to start reversing those trends. They didn't give it a chance to do that. On top of that, they made changes to primary healthcare providers not meeting the requested increase in co-payments to cover the increased costs for those providers, which means those providers had to increase their fees to cover their operation costs. And their decision to reverse the prescription fee subsidy means another added cost for people who are already struggling with a cost of living crisis. And the outcomes from all of these decisions means an increase in the number of people who end up in the emergency room. It gets so bad sometimes that hospitals have been known, just this week in fact, to put out notices like this asking people to stay away unless it's an actual emergency, which isn't always easy to tell when you're in pain and need help. So we have overcrowded hospitals, our overcrowded emergency rooms, people unable to seek medical care before their problems get worse, and unable to treat themselves with medication because of the increased costs. We also have staff shortages on the front line, and while we've been told those hiring freezes to pay for those tax cuts won't apply to frontline staff, that's not necessarily what the reports are saying, and there's added pressure to back office staff, which are also integral to the complicated systems needed to run our healthcare system, especially since the nationwide amalgamation was put on ice. And changes to the ability of frontline staff to work overtime or pick up extra shifts was reduced on top of a constricted hiring philosophy being in place. Oh, and all that before we even start looking at the numbers. The government claims that we're looking at an overspend of about $1.4 billion, or half the money that they gave to tax cuts for landlords. But the reality is, this government has delivered its budget with an increase in funding that's lower than the cost of inflation, which means in real terms, Te Whatu Ora has less money to do what they need to do. And they warned the government in select committee hearings about this before that budget was released, that this was going to happen. But the government chose to base their budget numbers on outdated data from the year before they instigated all their changes, which saw an increase in costs, a decrease in primary service use, added pressure to the entire healthcare sector, and less people being able to access medical care when they need it, or before it becomes something that they can't avoid. So when Dr Shane Reti gets up and starts claiming Te Whatu Ora are overspending and the board need to be replaced by a commissioner, it should be pointed out, is known within the Aotearoa medical fraternity for his narrow focus on top-down economics, unpopularity within the field, and a focus on running private healthcare providers and trying to run public health systems like private health providers, and claims that Te Whatu Ora are overspending. What he's actually saying is they're really underfunded. It's our fault, and the way we fix it is to bring in someone who will slash costs in the name of productivity, not look at how to make the system more fit for purpose for the growing, changing needs of Aotearoa New Zealand in 2024 and beyond. Which makes it even more impressive when I know that Mum was in and out of one of the busiest hospitals in the country in just 5 hours. Knowing the pressure the staff and the organisation are under, which is being exacerbated by a government determined to make everyone and every outcome some sort of dehumanised KPI.